Hi everyone, I'm Karen.
And I'm Joe. Together we're part of the amazing team here at marketplaceamerica.org.
Now, health insurance may seem complicated, but it's a crucial safeguard against unexpected medical costs, and we're here to help make it simple.
Yes, indeed. We're here to guide you, educate you, and help you navigate the world of health insurance with ease. We want you to make the best choices for you and your family's health.
Yes, our commitment is to make health insurance understandable, approachable, and tailored to suit your individual needs.
So join us as we dive into the ins and outs of health insurance, and remember, we're always here to help you.
Be sure to like, subscribe, and hit the bell for future updates.
So let's get started. Well, Karen, I'm going to start this topic off. This is how to save money on health insurance, and it's a comprehensive guide. Karen, do you know how to save money?
Yes, I do, and I like to talk about saving money.
Absolutely. It's like a coupon for health insurance.
That's right.
You got to understand this stuff, and the more you understand it, the easier it is for you to actually save money. So, Karen, let's start with an introduction. What do we have?
Well, health insurance is a necessity, but it's also a significant expense.
Yeah, absolutely. I like to say, if you're breathing and you don't have health insurance, stop procrastinating and go get it, because everybody needs it.
That's true.
Okay? So, what else we got?
But there's various types of financial assistance that can make it more affordable.
Financial assistance. That's like a giant coupon. We're
Yes,
going to
it
show them how to
is.
get those giant coupons when it comes to health insurance.
And the key to saving money on health insurance is understanding your options and taking advantage of the ones that apply to you.
Absolutely. Health insurance is complicated. There's many different aspects of it.
Right.
And you've got to understand some of the jargon, the terms,
Yeah.
to actually help you understand how you can actually save money in this environment.
And did you know with a 2023 study, nearly half of uninsured Americans are unaware they qualify for financial assistance?
That's just astounding, Karen,
It
that
is.
half of them don't understand they have financial assistance waiting for them.
Right.
And all they've got to do is apply and see how much they qualify for.
Yes.
So, Karen, when we're talking about saving, one of the things that we want to use to save are something called premium tax credits. Okay, also known as premium subsidies. What are these?
This is the financial aid that's going to lower your monthly health insurance payment. Basically, the government will pay this part of your premium for you directly to the insurance company.
Absolutely. You may know this more commonly as Obamacare.
Right.
Okay, these premium tax credits and subsidies were actually created through Obamacare, okay, or the Affordable Care Act. Those are two other terms that are actually commonly associated with it.
And they're available to individuals and families on the health insurance marketplace that have a low to moderate income.
Absolutely. And actually, I don't think it's that low of income.
It's not.
The subsidies are available up on the income. It does.
Oh, yeah, it's up to about middle income.
Absolutely.
And the amount of your tax credit is based on your estimated annual income and your family size.
Absolutely. The bigger your family, let's call it their tax family,
Right.
the more subsidies they're going to qualify for, and the lower their income, typically, the more subsidies they actually qualify
Correct.
for. Now, Karen, we've got an infographic up over here, and it says you may save this much on your premium. How much, Karen?
$892.
That's per month.
That's right. I'd like that coupon.
That's a good
Anytime.
coupon, isn't it?
Yes.
And what does that actually mean?
That means that they're going to pay that part of your insurance premiums for you.
That's
The
right.
government will.
And you're going to actually qualify for plans from $0 per month.
That's right.
I mean, zero.
Zero.
We're not misspeaking. You can qualify for health insurance for $0 per month, depending upon your income, depending upon your family size.
Right.
And you're going to actually see these screens in our software platform when you can actually quote health insurance. So, Karen, we have an example here.
So you have a family of four with an income of $35,000, and they could receive a premium subsidy that's going to significantly reduce their monthly health insurance premiums. Probably reduce the premium down to zero in this case.
Absolutely. And let's look at our infographic again.
Yeah.
That could have been that family of four qualified
Right.
for $892, and they're going to probably qualify for a plan. I know they're going to qualify for plans from $0 per month.
Oh, sure. Yes.
So, Karen, now let's talk about cost sharing reductions. So what are cost sharing reductions?
They lower the amount you pay for your out-of-pocket costs, like your deductibles, co-insurance, co-pays, most of your out-of-pocket expenses, and it also provides a lower out-of-pocket maximum.
Absolutely. There's that confusing healthcare jargon again.
Yes, it is.
Karen, let's take a second to plug our health insurance terms video. If you don't understand these terms, we have another video you can actually go to, watch it. We explain them in depth to you, how these terms work, so that you can actually understand them when you're actually getting ready to go buy health insurance, and you can make an informed decision.
Oh yeah, that's critical. And these are available, cost sharing reductions are available to people who purchase a silver plan on the health insurance marketplace. And again, they have the low to moderate income.
Absolutely. Silver plans are a little bit more expensive, but they come with more cost savings on after when you actually use the health care.
Yes. And your eligibility for these cost saving reductions are going to be determined by your income and family size.
All right, so it's again income and family size. And Karen, we have another infographic that they're going to actually find on our software platform, and it defines cost sharing reductions. And what does that actually mean?
It means cheaper doctor visits, hospital visits, prescriptions, lower deductibles, and your lower out-of-pocket max.
Absolutely, and it reminds you that it's got to be on a silver plan.
Correct.
And every plan that qualifies for the cost sharing reduction, you see that gold badge up there?
Yes.
Once you get into the software, it readily identifies the cost sharing reduction plans for you. So Karen, we have an example. What do we have here?
You've got an individual with an income of $25,000, and they're going to pay less for health care services thanks to the CSRs.
Absolutely. So Karen, what do you think we should do now?
Let's go to the software and take a look at these plans.
Absolutely. Let's show it to them in person.
Welcome to marketplaceamerica.org. Health Insurance Simplified.
As your trusted partner for health insurance, we're proud to be fully integrated with healthcare.gov, offering the same plans at the same prices.
What sets us apart is our streamlined process, which gives you access to 1-minute quotes and 10-minute enrollments.
With us, you gain the advantage of personalized assistance from licensed agents at no additional cost. Our primary aim is to provide you with hassle-free experiences, all while respecting your privacy.
And rest assured, we don't ask for any identifiable information until it's time for you to enroll in a plan.
Ready to explore your options? Start by clicking on the See Plans and Prices buttons on marketplaceamerica.org.
You might be surprised to find plans starting from $0 per month.
Welcome to marketplaceamerica.org, where navigating health insurance becomes an effortless task.
And let's click See Health Plans and Prices.
Absolutely. You always want to click on See Health Plans and Prices, and we're going to take you over and show you how easy it is to find how much savings you actually qualify for, Karen. So we're going to use 29369 as our zip code, and you always look up here. You got a question blue. What's your zip code? That's an easy question for you. Now we go, who needs health coverage? And we're going to say let's say we got a 35-year-old, and let's say female. And select any of the following that apply: not a tobacco user, not pregnant, not eligible for other coverage. Okay, so we're going to hit continue. Now let's say she's got a 1 year or a young child. So let's say we've actually got 2 people in the house, and it says, are any of the household members who aren't applying for coverage under age 19? Okay, so let's just say it's her daughter that's 5 years old, and we're going to say yes. And now, how much does she make? Well, we've got a great tool here that's an income calculator. And so we're going to click on this income calculator and add household income. So you talk to her, and she basically says she brings home about $450 a week.
Okay.
So let's go ahead and we'll say $450 a week and add that. That's about $23,400. Okay. So, and if we had something else, we can actually add another income item, but we're going to say she's only got one job, and that's what she's doing, and she doesn't have access to health insurance through that job. So we're going to use this amount, and we're going to hit continue. And wow, Karen, what do we got?
Oh, she qualifies for 2 kinds of savings: $564 a month on her subsidies, and then the cost sharing reduction and she also qualifies for the cost sharing reductions.
Absolutely. So, wow, I mean, savings is that easy to get to.
Yes.
In other words, we entered our zip code, we entered our estimated income. It didn't have to be actual income, and then Wow, it was that easy.
That easy.
Okay, and look, she's going to qualify for plans from $0 per month. So we're going to go ahead and hit continue right here. In the interest of time, we're going to skip, do you have any preferred doctors, pharmacy, or hospital? You can actually put those in. We actually highly recommend you putting the doctor's first name and last name in to actually search the database.
Yes.
Drugs, you can actually put those, but again, in the interest of time, we're going to skip this step, but you can put those in there as well. And now it says it's a good time to save your progress. If you want to enter your email address, you can actually enter your email address here and save that. If you don't, you can skip that and you say see your plans, and wow, Karen, we're already here at the plans looking at them, and notice we got badges saying this is the lowest premium, and we got 00 plans.
That's right. And you have your cost saving reduction plans. You see the gold star.
That's right over there. It's right over here, yep. And you've got lots of ways you can sort and filter everything down here, and then you can actually sort things by lowest premium, cost sharing available, lowest deductible. Fully functional, okay?
Yes.
But we really wanted to show you what your savings were. Right now, here's our savings again, $564, and your cost share reduction. But if you have any questions, have any concerns, need some help, call us. We're here to help.
That's right.
So Karen, let's go ahead and talk about Medicaid and CHIP and how to save money here.
Okay. Well, Medicaid and CHIP, which is your children's health insurance program, they provide free and low-cost health coverage to low-income individuals, families, children, pregnant women, the elderly, and folks with disabilities.
Absolutely. In other words, it goes really back to the federal poverty level.
Right.
Some states are less than 100% of the federal poverty level, other ones less than 138%. But basically, it is truly the lower income, okay? And both adults and children qualify for these programs.
Right.
So if they're eligible for these programs, you need to get signed up for those programs. And again, our software platform will actually identify when you should be eligible for Medicaid or CHIP, and it actually tells you about that.
And these programs cover a broad range of services, potentially saving individuals and families significant amounts of money.
Absolutely. And Karen, in our infographic over there, losing Medicaid, we know that due to COVID, due to the pandemic,
Right.
15 million people are actually going to be losing Medicaid. Okay? And their solution might be to go to the marketplace.
Sure.
Or Affordable Care Act, marketplace health insurance. So you got to understand there's a ton of people that are actually over there on Medicaid, and they've been using it for years.
Yeah,
and
yes.
they may actually have to transition away from that.
And their eligibility rules vary by state, but they're generally based again on the income, family size, and disability status.
Absolutely. And then as of 2023, more than 70 million Americans receive health care coverage through Medicaid. That's a
Wow.
huge group.
It sure
Now,
is.
to plug in another one of our videos, we actually have a video on the basics of health insurance, talking about the different types of health insurance that are out there. And one of the types of health insurance that's out there is Medicaid.
Okay.
And it's a significant piece of the entire healthcare network in America.
Yes. Let's take a look at health savings accounts and flexible spending accounts. HSAs and FSAs is what most folks call them.
Absolutely, Karen. So HSAs and FSAs allow you to contribute pre-tax dollars to pay for eligible healthcare expenses, effectively reducing your overall healthcare cost. In other words, you got to take pre-tax dollars and you're
Right.
going to put it in this account.
HSAs are available to those enrolled in high deductible health plans, while FSAs are typically set up through an employer's benefit plan.
Absolutely. And then the money you contribute to these accounts can be used to pay for many types of healthcare services and products. In other words, you put in pre-tax dollars. As long as you spend that money on qualified expenses,
Right.
the money actually never gets taxed.
So if you're in the 24% tax bracket and you contribute $1,000 to an HSA, you could save $240 on your taxes.
Absolutely. It's pre-tax money. You're not going to get taxed on that $1,000, but you can still spend that money on your health insurance needs.
Well, shopping around for health insurance.
Absolutely, Karen. We all like to go out there and shop. And when we go shop, we always like to save money. That's what we're
Yes.
talking about. So let's keep looking at that aspect.
So different health insurance companies charge different premiums for the same type of coverage. Therefore, you always want to shop around and compare prices and services.
Absolutely. I think about it when you go to a platform, you want to see different carriers. You don't want to go just to one carrier and say, well, that's going to be my carrier. I want to see how much it's going to be from all the different carriers and what my different options are.
Correct. MarketplaceAmerica.org has an easy-to-use platform for comparing those different health insurance plans.
Absolutely. You got all the different insurance companies that offer insurance through all 50 states out there.
Right.
So no matter what state you're in, you can actually use that platform, find the plan that suits your needs, and hopefully save money in the process.
That's right. Now keep in mind that the cheapest plan isn't always the best plan. You got to consider the factors like coverage, co-pays, your out-of-pocket expenses, and your provider networks when choosing a plan. So don't just look at the price.
Absolutely, and I also like for you to look at your doctors and make sure your doctors are in the
Sure.
network, and make sure your drugs are covered.
Yeah.
Okay, it's got to suit your health needs. It's not just all about price when it comes out to picking health insurance.
That's true. You'll end up paying more. A 2022 survey found that 63% of customers spent fewer than 2 hours researching their health insurance options.
Okay, well, I'm impressed with the 37% that spent more than 2 hours.
Right.
I'd really like to know how many of them spent more than 15 minutes.
Yeah.
Okay, and it's just health insurance is so complicated. Hopefully, you spend a little bit of time, get educated, look at our other videos.
Yeah.
Okay, learn the terms, and where you can actually make a more informed decision.
Now, something else to talk about when you're looking at health insurance is your right level of coverage. This is with Marketplace Insurance.
Absolutely, and basically you've got four different metal levels. You got platinum, gold, silver, and bronze, with platinum being the most expensive and bronze being the least expensive. And then these percentages out there, those used to be pretty standard. What we've noticed in creating some of these videos, that those percentages are all over the board. You need to make sure that the plan you're picking has got the right co-insurance percentage. So in general, what we got, Karen?
Well, in general, your higher premiums and have lower consumer cost sharing.
That's right. That's up there around the platinums.
And then the lower tier, the silver bronze, has lower premiums and higher consumer cost sharing.
Absolutely. So, and the other thing you want to, when you're talking about, we've already talked about, is the cost sharing reductions or cost sharing subsidies. Okay, and people between the 100% and 250% of federal poverty level actually also qualify for those. Those were the CSR badges, the yellow badges we talked about earlier in the presentation
And
today.
those are available with the silver plans.
And silver plans only, absolutely. So Karen, in conclusion, what are we going to say?
Well, when you're saving money on health insurance, that's going to involve understanding your options, evaluating your health care needs, and making an informed choice.
Absolutely. The more you understand, the more you know, the better choice you're going to make.
That's right. And take advantage of the financial assistance programs if you're eligible, and consider how different health plans align with your anticipated health care needs.
Absolutely. You want to get a plan that suits your needs. You don't want to actually just look, as we said before, for that cheapest plan out there.
Yeah, and evaluate yearly. And according to a 2023 report, Americans who understood their health insurance options and take advantage of financial assistance reduce their health care costs by an average of 30%.
That's a 30% coupon.
That's
30%
right.
off coupon, Karen.
That's a good one.
So if you put time into it, you're definitely going to save money.
Well, that's a wrap for today. I hope you found our discussion to be enlightening and valuable.
Yes, thank you for spending time with us today. We strive to make health insurance easier to understand and navigate, and we hope we've done just that for you.
If you have any questions, or if there's a topic that you'd like for us to cover in the future, please leave it in the comments down below. We're here to help.
And don't forget to like this video, subscribe to our channel, and hit that notification bell so you won't miss out on our future videos.
Remember, at Marketplace America, we're not just providing health insurance, we're providing peace of mind.
And if you are breathing and not covered by health insurance, stop procrastinating. Sign up for a health plan today.
Until next time, stay healthy and informed.